Migrant TV.
Hello everyone, welcome to Migrant TV Health Line. In this program, we will talk about topics of interest related to health with our specialist doctors and find answers to our questions. Surgeon Serdar Erdem is the guest of our first program. He is at Migrant TV studios today and will answer our questions about the flu virus. First of all, welcome.
Thanks for having me.
Thank you very much for accepting our invitation and being our guest today. We can start with our first question, if you please. First, what is the flu and how it is transmitted?
The flu is actually a viral disease, Hande Hanım. It is a disease caused by a virus that we call it influenza virus. Since it is a viral disease, it does not respond to antibiotics or anything, and is very common, especially in the winter month. Fever is of particular importance in case of flu. A fever above 38 degrees Celsius, headache, body aches, fatigue, there are the characteristic symptoms of the flu. In addition, nasal congestion and nasal discharge can also be experienced. In fact, nasal congestion can even cause problems that can lead to sinusitis if treatments, which we call symptomatic treatments, are not administered to relieve the relevant complaints. These are the most important symptoms of the flu. There are, of course, other symptoms as well. Nasal discharge may also be present in other diseases, but the flu symptoms also include the burning sensation in eyes complained by discharging cough. One of the most important symptoms of the flu may be cough, dry cough to be more precise, not a cough with phlegm. Individuals with such complaints may have the flu, but in cases of common cold, which we call the sniffles, one can also have such complaints. However, since they are milder, the difference between them and the flu is usually the difference between the severity of complaints.
As one of the issues that raise a question mark in all our minds, I would like to ask, when we have the flu, is it possible to distinguish it from COVID-19 or allergies?
One of them is caused by influenza virus and the other by coronavirus. The complaints caused by them are almost identical. Dry cough, headache, body fatigue, muscle pain, joint pain, nasal congestion, and a fever above 38 degrees Celsius. Both viruses cause the same symptoms. The only discernible complaint could be that in COVID-19, if individuals lose their sense of taste and smell, it may not be the case of everyone, then they could say that they have COVID-19. But if they are not experiencing a problem regarding their sense of taste and smell, then the only way to distinguish between these two viruses is to run a test. COVID-19 and influenza both have their own test. By doing both tests, we can ascertain which one is positive. On the other hand, cases of common cold and allergies are quite common in winter months and easier to tell apart from the flu. Even if cases of common cold and complained by these symptoms, they are much milder compared to the flu and COVID-19. Cough is typically not a common symptom in cases of common cold. Fever does not usually exceed 38 degrees Celsius, the period that we call the incubation period, where an individual catches the virus from someone and gets sick after a certain period of time, is 1 to 3 days in the flu, but in common cold it can take up to 5 days or up to a week. People may better understand if we put it in this way. For instance, influenza and COVID-19 each has one single causative agent. One is caused by a single virus, and the other is also caused by a single virus, namely coronavirus. On the other hand, common cold is caused by about 200 different viruses around the world. Therefore, there is no test for it. Which virus are we going to run a test for? That is why we cannot run a test for the common cold. But if there is sneezing, very mild fever, mild cough, maybe a sore throat, mild soreness, and if they last, 1-2 days and allow the person get back on his or her feet in a very short amount of time, we call this is common cold. But the flu, as I mentioned earlier, is accompanied by more severe symptoms. How do we distinguish allergies from others? Allergies does not cause most of the symptoms we have listed before. It does not cause fever, for example, or headache. Nasal congestion may be experienced due to allergies. Nasal discharge can also be experienced. Similarly, there may be sneezing but not cough. This is how we can tell them apart. Redness in the eyes, body itching or itchiness in tissuing lining in the interior of the mouth and nose are associated with the allergies. Allergies also have a seasonal tendency. Allergies are more commonly experienced in the spring month. On the other hand, the flu has a course that starts in the fall and spreads to winter month. It is much easier to tell one from the other. In other words, it is much easier to distinguish allergies from other diseases.
How is the flu treated?
How is the flu treated? Well, since the flu is a viral disease, we cannot treat it with antibiotics like we treat other microbial diseases. For this reason, there are some medicines for viruses which we call it antivirals. But we don't want to use them for everyone because they have side effects on some organs in the body such as the liver and kidney. We use them mostly for the people at high risk. In other words, those who could suffer ill consequences if they get the flu. Who are they? People above the age of 65, people with certain diseases. We can use the said medicines to prevent such people from experiencing severe symptoms of the disease. But otherwise, having rest is key to recovering from the flu. Vitamin supplements, drinking plenty of fluids, or taking antipyretics are treatments for the complaint that aim to relieve the person.
What advice can you give to the Healthline viewers about the precautions that could be taken to prevent the flu?
For instance, almost everyone used to wear face masks during the pandemics. Why did they wear masks? To avoid catching COVID-19. But many people also realized that as long as they wore masks, they did not get the usual common cold or the flu either. In other words, while aiming to protect themselves from COVID-19, they protect themselves from other diseases too, even from allergies. That is why wearing masks is crucial in protecting oneself against the flu. In fact, we need to continue to abide by mask distancing and hygiene rules in the same way as we did during pandemic. Hand hygiene is of significant importance when it comes to the flu, because the flu infection is transmitted when people cough or sneeze or thereby release secretions from their respiratory system, which we call droplets, into the air. These droplets they release into the air are not only transmitted through inhalation. When they land on a surface, people touch those surfaces. After that, as you know, people tend to play with their hands, their faces, their hair. If you do not wash your hands, you will get all that viruses, microorganisms, and whatever are presented in the environment on your hand, face, nose, mouth, and that is how it is transmitted. These are important. Apart from these, there are some things needed to boost the immune system, namely taking vitamin C and D regularly, having a diet that includes certain foods, citrus fruits and green leafy vegetables, especially in the winter month, taking these vitamins. But if we are having trouble finding such vegetables, there are ready-made tablets containing vitamin C, D, and A, as well as zinc. Or we can protect ourselves against the flu by taking these types of supplements. But the most important thing to do personally here is to wear masks, to distance ourselves from the other people, and not to engage in too much close contact as opposed to what we used to do before. For example, you may not even shake hands when greeting somebody, and ensuring hygiene is very important.
We also have a few questions about the vaccine. What age groups do you recommend the flu vaccine for, and when should one get the flu vaccine?
Everyone older than 6 months can get the flu vaccine unless they have certain conditions, because there are some people, some diseases, some conditions for whom or in cases of which the vaccine should not be administered. Except for such cases, everyone older than 6 months can get the flu vaccines. The dose is almost the same as the dose given to the adult. The dose we give to children is also same as the adult dose. When it is administered, especially in October and November, why do we do that? Because winter is coming and the flu cases will increase. Also, every year after the end of winter, that is, following the beginning of spring, a vaccine is developed against the year's flu virus. And it takes until the fall, around the September, to develop the new vaccine. And we can get the flu vaccine just before winter in September, October. Vaccine can continue until the end of March, and the vaccine protects us from the flu for 6 to 8 months. This should not be understood as, I have been vaccinated, I will never get the flu again. The vaccines are developed to make sure that we do not experience very severe flu symptoms. We may still get sick, but most likely we will have mild symptoms.
Is it possible to see an increase in the flu cases with the opening of schools?
Of course, crowded environments are problematic as they facilitated the spread of the flu virus, so are schools. Now, classes are already consist of 60 to 70 students in many schools. That being the case, it is difficult to force children to wear masks as it takes a while for them, especially for younger kids in kindergartens, to learn how important the hygiene is. When schools start, of course, we will see the increase in the flu cases. It is as sure as 2 and 2 is 4.
Does it exacerbate the risk to life if people get the flu virus and coronavirus at the same time?
Yes, this is an important issue. This is why we urge people to get vaccine for seasonal flu. People can get the flu and COVID-19 at the same time. When this happens, the risk to life gets a lot higher because when the body's immune system is dealing with virus, contraction of another virus may result in the body being confused about what to do. Sometimes the immune system reacts too much, which creates difficulties in terms of recovery. It can even damage the body's organs and cells. Therefore, two concurrent infections can be quite dangerous. That is why we need to get the flu vaccine every year to at least have a very mild seasonal flu or no flu at all. Also, we should definitely get our COVID-19 booster shots when they are due.
Thank you very much for your time, for answering our questions, and for being our program guest.
Thank you too. Thank you for having me.
This is the end of our Healthline program. Surgeon Serdar Erdem answered our questions regarding the flu. We hope to see you in our next program, where we will provide you with new information and answer your questions related to health with our specialist doctors. Goodbye.